And we are live. Please start.
Good afternoon, everyone. On behalf of Nash 24/7, I welcome you to our public awareness program on decoding the fatty liver. Nash 24/7 aspires to bring best-in-class education and awareness program to serve healthcare workers, patients, and their caregivers. To break the silence on Nash, today we have a renowned gastroenterologist from Indore, Dr. MT Noor. He needs to no introduction. However, I would fail my duty if I don't mention that. Dr. MT Noor is a leading gastroenterologist in Indore, providing a comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient-centric care. He is currently associated with SAIMS Hospital Indore as a consultant gastroenterologist. Sir, on this International NASH Day, we salute your dedication towards spreading awareness related to liver health. So now I invite Dr. Noor to enlighten us on the topic. Over to you, sir.
Thank you for the kind introduction. And in the current scenario, it's a very hot and very, very important health topic. And we all need to know about this entity as it has health consequences all over the world. So first of all, I would like to congratulate you all on this NASH Day. And it is very important to celebrate as well as to know about this entity. It has short-term as well as long-term health consequences, and now it has become the leading cause of liver damage, or what we call liver cirrhosis around the world. So it is very important to know about this disease entity, to be aware and what we can do to treat or to prevent this entity. So it is very important. So first of all, we have to be aware, and in the next few minutes, I will be discussing about this entity. So can we move forward? So it is basically this is a global pandemic. So the goal of the International NASH is to raise awareness about this entity and to take action by the people to prevent this entity. This is basically this is a initiative to prevent this entity. So that's why we are celebrating this International NASH Day. So we will be discussing about this entity in the next slides. So as we all know, liver is the second largest organ of the body. It weighs about 1.5 kg with about 5% of the fat. So when the fat percentage increases by more than 5%, so that is called fatty liver. So the location of the liver is in the right upper abdomen. It is pinkish brown normally in color with soft consistency, and it's a highly vascular organ. Next slide. So the function of there are various functions of the liver, including destruction of the old RBCs, production of different proteins, detoxification function. It detoxifies various compounds, including ammonia, breaks down toxic substances like alcohol, and metabolizes various drugs, and in addition, it produces bile, which plays very important role in the digestive process. Next slide. So, non-alcoholic fatty liver disease is a condition in which fat content of the liver increases by more than 5%. And to diagnose this entity, there should not be significant alcohol consumption, because as we all know, alcohol also leads to a fat accumulation in the liver. Having there are various risk factors for this entity, like overweight or obesity, presence of type 2 diabetes, or high dyslipidemia. So if these conditions are there, they will increase the propensity to develop fatty liver disease. So out of four, 1 out of 4 people in the world have NAFLD now, and more than 6 diabetes and 9 severe obese individual out of 10 have NFLD. So in addition, male gender has been regarded as a risk factor for progression to Nash in patients who have fatty liver disease. So there is a gender difference. So there are various stages of this disease entry. To begin with, next slide. So initially we have healthy liver, then our liver starts accumulating fat. Then over a period of time, there is development of inflammation and subsequently fibrosis. So fibrosis basically scarred tissue in the liver. And then subsequently, in addition to fibrosis, there is nodule formation. And then it progresses to full-blown cirrhosis, which is a reversible process. So our idea is to prevent the development of cirrhosis ultimately. Because once there is cirrhosis, you cannot totally revert that condition. Next slide. So this is showing fat accumulation in the liver. Then over a period of time, when there is 20% of the individual who have fat can subsequently develop inflammation in the liver. And then that inflammation, whenever there is inflammation heals by scarring, by fibrosis. So then subsequently it progresses to cirrhosis. So it is very important to identify these entities at an early stage so that we can halt their progression by dietary modification and several other things which I will discuss in the next few slides. So causes of NASH include obesity, genetic background, food intake, metabolic presence of metabolic syndrome, exposure to medication, and physical inactivity. Next slide. So once there is, we accumulate fat in our body, then subsequently obesity increases the amount of fat to constitute 5 to 10% of the liver weight. And then it subsequently there is development of inflammation and NASH. Next slide. So there is in patients who have NFLD, there is threefold increased risk of death due to cirrhosis because of increased risk of NASH. So in patients who have NASH, there is high prevalence of diabetes in them, 2 to 4 fold increased risk of developing diabetes in these individuals because of development of insulin resistance in these individuals. Next slide. So non-alcoholic steatohepatitis, NASH, what are the symptoms? Most of the patients remain asymptomatic to begin with. However, some individuals can have fatigue, right upper abdominal discomfort or pain. Next slide. So how do we diagnose this condition? You usually diagnose this by doing certain tests like ultrasound examination of the liver, which shows bright liver. And then we can do blood tests in the form of liver function test, which can show raised liver enzyme. And then finally, the conclusion, the confirmation of the diagnosis is by doing liver biopsy, in which we take a small piece of the liver, which is very small in size, and then we subject this liver piece to histopathological examination, and thereby confirming the diagnosis. But liver biopsy is a invasive test. Most of the time we rely on non-invasive tests like blood tests, ultrasound, and a fibro scan, which because as the fibrosis advances into the liver, the liver becomes stiff. So fibros can measure the stiffness of the liver. Then there can be certain role of MRI, CT, which can all quantify the liver fat by different methods. Next slide. So most commonly performed blood tests are SGOT and SGPT, which are liver enzymes. The patient with normal LT can also develop progressive disease. So although if the liver enzymes are elevated, then it will confirm Nash. But if in certain patients with Nash, the liver enzymes can be normal also. So they can have silent liver inflammation. Next slide. Then there are certain scores like FIB4 score, which include age, AST, LT, and platelet count into account. And then NFS and NFLT fibrosis score, which includes age, AST, LT value, platelet count, BMI, fasting blood sugar, and albumin level of the individual. These scoring methods have been established to diagnose more better than ALT-ST alone. Only online tools are available to calculate these scores. You can enter values from your blood report and generate this score to understand the risk of developing Nash. Next slide. So ultrasound is a very easily available diagnostic modality to diagnose liver fat, as it is economic also. But there are certain limitations. It can only detect liver fat if it is more than 25%. Although more than 5% is abnormal. And it cannot differentiate whether there is only fat or fat, along with fat, there is development of fibrosis. So fibrosis can be detected by only doing elastography or a fibroscan. Next slide. So this is another useful tool to diagnose extent of fibrosis. So in which diagnose NFLT, it can detect fat if it goes above 10%, and in contrast to ultrasound, which detects fat when it is more than 25%. It can diagnose fat at an early stage, and it can also detect development of fibrosis. So, and it is objective test, easy to operate. However, there are the results can be falsely elevated in patients with obesity. Next slide. So this is the transient elastography measurement. How is it done? This is the machine, which is a non-invasive test. LSM is liver stiffness measurement with the degree of fibrosis. And we calculate the CAP value, which is control attenuation parameter, and it indicates the degree of steatosis in the liver. Next slide. MRI is another good modality to detect fat. It can measure fat when it is more than 1%. Widely used technique for liver donor patients. So it is highly sensitive method to quantify liver fat. However, it is costly, not widely available, and for this certain individual, they feel claustrophobic with the MRI. So there are few limitations. Although it detects fat in a global manner, because in ultrasound you put the probe on a particular portion of the liver only, and it quantifies liver in a more global fashion. Next slide. And the gold standard is liver biopsy. However, it is invasive. So only ideal method to diagnose Nash, because as we saw, most of the other tests, including fibroscan, ultrasound, they detect the degree of steatosis as well as fibrosis. But these tests cannot detect inflammation, what is going on inside, what is the extent of inflammation inside the liver. So that can only be detected by either blood test, AST elevation, or histology. But As we discussed earlier, the liver blood test SGOT, SGPT can be normal even if inflammation is there in some of the individual. However, it is painful and there can be sampling bias even in liver biopsy. Next slide. So, although it can develop to cirrhosis and even hepatocellular carcinoma, but usually the progression of this disease is slow, as reflected in this slide. About 1/4 individual who have liver fat can progress to Nash, and rest remain just isolated fatty liver without any significant inflammation or fibrosis. And then once they develop Nash over a period of 15 years roughly, about 1/10 of them develop cirrhosis. And then out of those who develop cirrhosis, about 7% develop SCC. And out of those who develop cirrhosis, and several of them, about half of them, decompensate over a period of next 7 to 10 years. So once there is development of cirrhosis, there is increased risk of mortality and morbidity. So the risk of death because of other cardiovascular illnesses is also higher in patients with Nash as compared to general population. So, and the development of malignancy is also higher, particularly SCC. Next slide. So, the message is to act before it's too late. So, because severe Nash is also not reversible, and once there is development of cirrhosis, it's by definition an irreversible process. Next slide. So treatment is multi-dimensional. We have to target on our diet with lowering of with higher fiber content, higher proteins and less of carbohydrate and fat. And we need to increase our physical activity. We need to do certain lifestyle modification like cessation of alcohol consumption, cessation of smoking, and there is some role of medications also. Next slide. So, combination of hypocaloric diet and moderate intensity exercise provide best likelihood of sustained weight loss. Weight loss of at least 3 to 5% of body weight helps to improve steatosis. Weight loss of 7 to 10% to improve majority of histopathological features of Nash, including fibrosis. Next slide. So, what is the effect of weight loss on the natural history of NFND? Where once we lose more than 10%, there is reduction in fibrosis. When we lose more than 10%, there is resolution of inflammation. Then weight loss of more than 5%, there is a reduction in inflammation. And with weight loss of more than 3%, there is reduction in steatosis. Next slide. So, diet for healthy liver includes a lot of fiber and a lot of proteins, fresh foods, and all those things which improve liver function, and less of fat and sweets and carbohydrates. So this is you need to take a diet rich in fiber and fresh fruits and proteins and less of carbohydrates, particularly white sugar needs reduction in content, and then less of fat content. And you need to lose weight. Next slide. So then you need to burn your calories by doing aerobic and resistance exercises. Aerobic exercise reduces liver fat, maintains healthy weight, improve cardiovascular conditioning, Resistance exercise reduce liver inflammation, improve glucose absorption, improve metabolic parameter with less energy consumption. Next slide. Lifestyle tips which are helpful for Nash: get enough vitamin and minerals, regular medical checkups, get enough sleep, easy small frequent meals need to be taken, develop an exercise routine, lower your blood sugar intake. So these are the important health tips which need to be applied to lessen your chances of developing Nash and to revert these harmful liver conditions. Next slide. So as far as the role of pharmacological therapy is concerned, several molecules have been tried in the recent past, but these are the promising ones which have shown some benefit, including vitamin E, then role of lipid lowering drug, saroglitazole, which particularly this is a PPR agonist, and then the saroglitazole reduces the extent of Nash with reduction in fibrosis in both diabetic and non-diabetic Nash patients. Pioglitazone, which is an anti-diabetic drug, it also improves fibrosis and inflammation in both diabetic and non-diabetic individual, and vitamin E. However, the duration of therapy is shorter with saroglitazole as compared to vitamin E and pioglitazone. Next slide. What are the tips to prevent fatty liver disease? Limiting intake of saturated fat and trans fat, quitting smoking, eating a balanced diet, doing regular exercise, limiting consumption of refined carbohydrate, limiting alcohol consumption, maintaining a healthy weight, and then you need to take some medications to further improve your chances. Next slide. So that's all about Nash, and thank you all for your kind listening. Can you hear me?
Right. Thank you so much, sir, for this valuable and informative talk.
So I invite any question if they are there.
Yeah. So with your permission, can we take some questions from the audience?
Yeah.
Yeah. So we have some common questions here. So first is that what are the symptoms for NAFLD and when a patient should go for a visit to a specialist?
Yeah, and we discussed the symptoms are quite non-specific. Most of the individuals remain asymptomatic. So basically, the indication of visiting can be just when you have gained, when you have, particularly if you are overweight or obese. However, in India, it has been seen that even if people who are thin, there is a concept of lean Nash. Even if you are not obese, you can still have excess liver fat in your liver. So ideally, everybody should get regular checkups, particularly after 40 years of age. And if you have excess fat, and it has been seen that even those who are not obese, reduction in weight, even in those individuals, leads to improvement in fibrosis as well as liver fat. So most of the time, these entities, however, some individuals can have fatigue. Some of them may complain of heaviness in right upper abdomen and sometimes non-specific pain. But large majority of these individuals remain asymptomatic.
So guys, it is not important that if you are having obesity, only then you will be getting NAFLD or Nash. Even the lean patients are, as Dr. MT Noor has already suggested, that even lean patient has to go for their regular checkup.
Yeah.
So, sir, there is one another question that everyone asks, that is Nash age specific?
Although the chances of developing NASH increase with age, but now with the changes in lifestyle of even young individual, even in childhood, we see cases of childhood NASH also, because of the immobility of children nowadays, more mobile use, more refined sugar intake. So now even childhood obesity is not uncommon, and those obese child, several of them develop fatty liver disease, and they also have risk of developing NASH also. So it is not more over a period of time. The age at which individual develop NASH, that age is decreasing day by day, and even children are not immune to developing this entity.
Right. So this is an alarming situation for even parents as well, to keep their children active and to take care of what they eat and how they behave in the day. So, sir, we have one another question, that are there any available medicines for Nash? Can it be cured?
Yeah, actually, as I already said, that the medicines are there, but this treatment of this entity requires a holistic approach. Actually, so first of all, to begin with, you need to limit your weight, whatever weight is there. You should lose at least 10% of the body weight by doing exercise, by limiting your calorie intake, by limiting your carbohydrate and fat intake, and then several other things. If you are diabetic, you need to control your blood sugar, and you need to improve your metabolic parameters, do regular exercise, physical activity, and all these things are very important. And then, in addition to that, if there are if there is a state of sustained inflammation, if your liver enzymes are raised particularly, then you need certain drugs. And in that, or in the current scenario, in the Indian scenario, saroglitazole has a very promising role, and with shorter duration of therapy. And in addition, two more drugs, vitamin E and pioglitazone, have shown some promise in the treatment of this important clinical condition.
Right. So there is availability of medicine, but the requirement of medicine is only after, if you are not able to control your lifestyle changes.
And also it depends on the stage of the disease at which you present to your doctor.
Right. So, thank you, sir. So now I would like to thank Dr. Noor on behalf of Nash 24/7 for this lively and informative talk. Sir, as you have been emphasizing the awareness for liver health and disease, I think it is equally important for people affected by fatty liver to regularly visit doctors and continue medication. With careful observation and precaution, it is possible to obtain control on the disease. Yeah. I would like to thank our audience for their active participation and patience in making this event successful. Stay connected with Nash 24/7 on Facebook and take care of your family members. Thank you.